Marijuana is a topic that many Americans today find to be subjective, depending on whether an individual is an avid smoker or scientist or simply an enthusiast. It seems today that the idea of using it has changed as compared to years back. Through studies, it is believed that marijuana should become legal to three main reasons. The first one being that the medical use of it is superior due to the natural body of it as compared to using other procedures such as chemotherapy or the use of other opiates. And it also has the second reason being that it has possible connections to extending the life of cancer patients. And the third and last reason is that it is simply just self-sufficient in all areas of the medical field, not just the ones that were previously discussed. And now we transition into the first reason. The first reason being that the medical use of it is superior.
The government should legalize medical marijuana usage because marijuana is natural and not made of harmful or dangerous ingredients like chemotherapy and opiates are. Peter Grinspoon, a medical doctor speaking about medical marijuana usage, says, "Marijuana is quite effective for the chronic pain that plagues millions of Americans. Part of its allure is that it is clearly safer than opioids, and it is impossible to overdose and far less addictive. The numbers of overdoses from opioids are quite shocking. In 2017, over 17,000 people died from opioid use that involved prescription opioids. That number has been increasing since 2014 steadily. On the other hand, marijuana has no serious side effects that some drugs that are approved by the FDA have, and overdose is medically impossible."
Patients undergoing medical treatment for cancer typically aren't left feeling the best. There is pain associated with the drugs given to cure cancer, as well as severe nausea, lack of energy, depression, and loss of appetite. In more recent studies, doctors have been seen testing the uses of marijuana on patients to improve their lives by counteracting these side effects. According to the American Cancer Society, small studies of smoked marijuana found that it could be helpful in treating nausea and vomiting. While it can be difficult for patients to want to eat, a small dosage of marijuana, more specifically THC, can help improve the health of patients by encouraging them to eat. A link between hunger and smoking marijuana has also been found. By decreasing their symptoms and increasing hunger, patients have found eating to be much more manageable. And by lessening the hunger in patients' bodies, they are increasing the nutrients needed to make patients stronger and healthier. This increases their life expectancy and helps make their treatment go much smoother. Marijuana has also been proven to help decrease the physical pain associated with treatments, again improving the life of the patient. Studies have also begun to see if there is a link between marijuana and actually curing cancer, but there is yet to be enough data found to prove whether this hypothesis is true or false.
With the rise of marijuana usage over the past decades, there has been many researchers, one of them being the National Institute of Health, discovering the possible uses of cannabinoids, including THC. Medical marijuana is most commonly used to help treat pain. However, it's been said in research to have multiple uses and benefits. Marijuana is currently used to help treat Alzheimer's, epilepsy, eating disorders, Crohn's disorder, glaucoma, multiple sclerosis, and cachexia. It is also used to help mental disorders such as post-traumatic stress disorder and schizophrenia. Scientific studies of the chemicals in marijuana, known as cannabinoids, has even led to two FDA-approved medications, dronabinol and nabilone. The two medications help with chemo-related nausea and increasing appetite for AIDS patients suffering from extreme weight loss. The FDA has also very recently approved of cannabidiol Epidiolex in 2018. The drug treats two forms of epilepsy, Lennox-Gastaut syndrome and Davy syndrome. In studies conducted pertaining to Epidiolex, patients have reported a dramatic drop in seizures after taking the drug. Seeing that marijuana is not nearly as dangerous as opiates, not as addictive, and has an abundant amount of health benefits, the government should legalize marijuana usage in all 50 states.
Studies say that it can prevent cancer and other medical issues, so it shouldn't be a problem for it to become legal. It doesn't cause any terrible medical issues or side effects to the human body, compared to many other legal medicational drugs that has been distributed around the U.S. today. It has so many benefits that marijuana has to offer to the human body. There's proof that it may cure cancer and expand expectancy and other medical uses for marijuana. The government should legalize marijuana usage because it is natural and not made of any